The principle of defibrillation is to deliver a current to depolarize a critical amount of myocardium so that ventricular fibrillation is abolished. If the heart is viable, the natural pacemaker of the heart takes over after a variable pause. Recurrence of VF should not be considered as a failure of the shock. Shock success cannot be equated to restoration of a perfusing rhythm or survival. Biphasic and monophasic waveforms have been used for defibrillation. Old defibrillators used to deliver monophasic waveforms, while the newer ones deliver biphasic waveform. Monophasic, as the name implies, delivers current in only one direction. Biphasic shocks of 200 joules seem to have efficacy similar if not better than 300 joules of monophasic shocks. High efficacy of biphasic shocks would mean that final outcome will depend more on the interval between collapse and CPR or defibrillation.